So hello guys, welcome back to a new video of Medico YouTube channel. So today we are dealing with electrocardiography. It is a very simple or basic video. After that, I will make how to read a ECG. Okay, ECG is electrocardiogram. So what are the learning objectives? Introduction, history, normal ECG, procedure, and limb leads. First, we will get the overall overview, like how is ECG, what are types of limb leads, how we will determine the potential, and what are the different segments, waves of the ECG graph. Okay. First, ECG basic. There are three terms. One is electrocardiography, electrocardiogram, electrocardiograph. Okay. One twist is that electrocardiogram is the graphical representation. Electrocardiograph is the instrument. Electrocardiography is the technique in which the electrical activities of the heart is recorded or studied. Okay. Next, what are the uses of this ECG or EKG? ECG is also known as EKG. Okay. Heart rate, heart rhythm, abnormal electrical conduction, poor blood flow to the heart muscle, that is ischemia, and heart attack, coronary artery disease, CAD is coronary artery disease, hypertrophy of the heart chambers. These all diseases can be determined by ECG or EKG. Okay, that's why ECG holds the one of the major bulk laboratory diagnostic technique, not diagnostic technique. Okay, ECG leads are unipolar and bipolar leads. ECG leads are classified into unipolar and bipolar. In unipolar, there are two types: unipolar limb leads and unipolar chest leads. And in bipolar, there are standard limb leads. Okay. So what are those limb leads? There are totally 12 leads in ECG. Okay, 3 limb leads, that is L1, L2, and L3. That is and 3 augmented limb leads, that is AVR, AVL, and AVF. And 6 chest leads, that is V1, V2, V3, V4, V5, and V6. Okay. So 3 limb leads and the 3 augmented limb leads determine the electrical activity of the heart in the vertical plane, and the 6 chest leads determine the electrical of the heart in the horizontal plane. That's why the chest leads turn to be horizontally applied. Okay. In ECG, there are totally 12 leads, and in that, first 3 are limb leads, that is L1, L2, and L3. 3 are augmented leads, that is AVR, AVL, and AVF, and 6 chest leads, that is V1, V2, V3, V4, V5, and V6. Limb leads and the augmented leads identify the electrical activity of the heart in the vertical plane, but and the horizontal chest leads, that is V1 to V6, identify the electrical activity of the heart in the horizontal plane. Okay. You can see ECG leads are divided into unipolar and bipolar. Unipolar limb leads and unipolar chest leads. And in bipolar, there are standard limb leads. Standard limb leads are L1, L2, and L3. Unipolar limb leads are AVR, AVL, and AVF. Unipolar chest leads are V1, V2, V3, V4, V5, V6. Okay. Have a look. Chalo, next. ECG or EKG, electrocardiogram. It is a procedure of recording the electrical activity of the heart. The electrode combination records the difference of potential difference at two sides of the body. The potential difference are produced due to electrical activity of the heart. Potential difference are produced due to the electrical activity of the heart. Electrocardiograph is the machine. Electrocardiogram is the record. Electrocardiography is the technique. The characteristic shape and timing of the ECG waves are due to spread of waves of depolarization and repolarization associated with each heartbeat. Depolarization means contract, repolarization means relax. Have a look. You should know the conductive system of the heart. Conductive system of the heart, SA node. From there 3 fibers arises and then goes to the AV node. From AV node there is AV nodal delay, and from AV nodal bundle then goes to the AV nodal bundle. Then it put to the Purkinje fibers. The ventricles contract. So here you can see there is atrial depolarization, ventricular depolarization, then ventricle relax, that is ventricular repolarization. 3 events. Okay, main 3 events of P, QRS, and T waves: atrial depolarization, ventricular depolarization, ventricular repolarization. You should know the conductive system of the heart. It is a 5 marks question. So here you can see SA node, internodal pathways, AV node, AV bundle of his, bundle branches, and Purkinje fibers. Have a look of it. Next, William Ethinoven won the Nobel Prize for this Ethinoven triangle and his work in ECG. Okay, the ECG is not only the oldest, but in fact over 100 years after its introduction, continues as the most commonly used cardiovascular laboratory procedure. One of the best thing, ECG. How does ECG look on a graph? Here you can see this is the ECG on a graph paper. Okay, the one thing. This is take this as a baseline. The graphs which are going up are taken as positive, and the going down will be negative. Okay. So this is the isoelectric baseline. The waves which are going upside will be positive. The waves which are going downside will be negative. There are waves, segments, and intervals. Okay. First, we will cover the waves. There are totally three waves: P wave, QRS complex, and T wave. Okay. P wave. P wave is because of atrial depolarization. QRS complex, ventricular depolarization. T wave, ventricular repolarization. Where is atrial repolarization? It merges with the QRS complex. Okay. And totally there are segments. Totally there are three segments. Next one is PR segment, between from this P and this R. Okay, here PR segment. It after the atrial depolarization there will be some time gap. The PR segment is because of that time gap. Okay, and another one is a ST segment, from this S wave to this beginning of the T wave. This is ST segment. Another one will be TP segment. Okay, from this T to next P wave. Here it will come. These are three segments. Another are intervals. There are totally 5 intervals. I will name them. PR interval, which covers the P wave, P and R, which has the P wave. ST interval. Next is QT interval. RR interval. RR interval means the interval between one R to the next R. Okay, here the interval between one R to the next waves next R. This is RR interval. Next is PP interval, from one P to the next waves next P. Okay, this is PP interval. Totally there are 3 waves and 3 segments and 5 intervals. Okay, here you can see P, QRS, and T wave, just dummy. And this is a clear picture. You have to draw like this in exam. So electrocardiogram waves: P wave, QRS complex, and T wave. P wave, atrial depolarization; QRS complex, ventricular depolarization; T wave, ventricular repolarization. Intervals and segments, I have already told them. You just go through them. Okay, this one table completely covers everything. Okay, with the duration and amplitude. The duration are important. For P wave, it takes 0.1 second. Atrial depolarization takes 0.1 second, and amplitude is 0.1 to 0.12. It makes no sense me telling this everything. You take time, take a screenshot of it, and go through all these things. Okay, it's very important. Different segments and waves. The one which D indicates is the resting membrane potential. Resting membrane potential means the heart is in heart is never attains resting membrane potential, but like a muscle is at resting membrane potential. Inside is wholly negative and outer surface is completely positive. If outer surface is wholly positive, then no current flows from outer surface. So therefore the potential shows no deflection. It will be like this only. When an impulse arrives, you can see A. When an impulse arrives, there will be exchange of ions like potassium and calcium. Exchange of ions. This type of graph you may have remembered, like this cardiac 0, 1, 2, 3, 4 phases. Okay, as impulses arrive, the positive ions, there is rapid influx of positive ions, and outer negative potential is developed. Therefore, you can see a deflection of positive deflection upside. Then whole the muscle potential is reversed, completely reversed. Then you will get a depolarization wave, and after that the muscle wants to relax. That is repolarization of the muscle. You will get a reverse wave. Okay, see this, you might understand. Recording depolarization and repolarization wave. Next, the flow of current in a chest around the partially depolarized ventricle. You can see what does this indicates. This indicates that the potential is measured in the form of vectors. Okay, everything in the form of vectors. You need not to necessary to understand all the vectors. Just you need to understand. Okay, means like you need to think. Generation of a dipole over the heart. Now imagine this is a heart surface. This is a heart, and you are seeing only surface. Okay, and all outer surface is positive, wholly positive. Therefore this shows no deflection. There is no deflection. When there is occur of an impulse, from SN node any impulse occurs, there will be slight negative charge. As negative is there is slight deflection of this ammeter or voltmeter. Okay, there is slight potential change in the potential. As this negative spreads, there will be more deflection, as more is the potential difference. So one more thing, as negative charges are going in this direction, and therefore the current flows in the opposite direction, okay, in this direction. Therefore the deflection is in this side. The stick deflects this side, okay. The current flows in the opposite direction of the negatively charged. If negative charge goes this direction, the current flows this direction. As more and more it is covered, the deflection decreases. At one point, everything will be negative. Therefore, there is no potential difference. There shows no deflection. If everything were positive, then also if everything is positive in previously, then also it didn't show any deflection. You can see everything is positive. There is no deflection. In the same way, when everything is negative, there is no deflection. Remember the point, the representation of the electrical activity of the heart is critically dependent on the position of the electrodes. The same electrical activity will look different on different electrode combination. The phrase means when you place the position of the electrode matters, okay. When you remove this, here you can see these electrodes are present on the surface of the heart. I will remove one electrode and keep it somewhere here, okay, somewhere here. Then negative, there will be no deflection. The position of the electrode matters, okay. The phrase means the position of the electrode matters. What is a lead? What is a lead? The combination of electrode for recording is called as lead. The combination of electrode is known as leads. What are the types of leads? There are three types of leads: unipolar and bipolar. I have already said. Bipolar are standard limb leads that were given by William Ethnoen, and augmented limb leads AVR, AVL, and AVF were given by Goldberger, and precordial chest leads were given by Frank Wilson. Totally, there are 12 ECG leads. Next, this is a diagram which shows the Ethnoen triangle. Okay, this is the right arm, left arm, and the left leg. There are the potential difference is recorded between these three. Okay, remember one thing you should remember: right arm is always negative and left leg is always positive. With this you can understand. And lead 1 goes from right arm to the left arm, and lead 2 goes from right arm to the left leg. These points you should remember. Right arm is always negative, left leg is always positive, and lead 1 goes from right arm to the left arm, and lead 2 goes from right arm to the left leg. Right arm you remember, you will understand the whole triangle. Electrodes are attached to the skin surface. The leads consist of 2 electrodes, one positive and one negative. Now let me show. This is the right arm. Right arm is always negative and left leg is always positive, and this is variable. Okay, and lead 1 goes from right arm to the left arm, first thing, and lead 2 goes from right arm to the left leg, and lead 3 goes from left leg to the left arm to the left leg. Understand? Okay, you will understand now. See, this is what I was saying. You just go through it. This is Ethnoen triangle or Ethnoen law. What is Ethnoen law says that lead 2 is equal to the sum of other two, lead 1 and lead 3. I would go through the Kirchhoff's law because it is more convenient. According to the Kirchhoff's law, the algebraic sum of the voltage rise is in a closed circuit is equal to the algebraic sum of the voltage drops. Read this, you will understand what I am saying. Okay, this is 10 plus 6 is equal to 16. And 16 minus 6 is equal to 10. And 16 minus 10 is 6. This is what I was saying. Limb lead 2 is equal to the sum of 1 and 3. Okay, sum of all the algebraic sum of all the potential is equal to 0. Unipolar limb leads. Unipolar limb leads are VR, VL, and VF. Augmented limits AVR, AVL, and AVF. One more derivation is there, one small derivation. For that it is a MCQ in NEET PG. Augmented lead is 1.5 times of the unipolar lead. Unipolar leads are VR, VL, and VF. Augmented leads are AVR, AVL, and AVF. Okay, let's see the derivation. AVL is equal to VL minus VR plus VF divided by 2. So we will take the LCM, and downside 2 is taken this side. 2 AVL is equal to 2 VL minus VR plus VF. We know from the Kirchhoff law that sum of all the potential is equal to 0. VL plus VR plus VF is equal to 0. One more thing. What is VL? Potential at left arm. VR is potential at right arm. VF is potential at the foot. Okay. from the above Kirchhoff's laws, VL is equal to minus of VR plus VF. We will put that in, this is same as that of here, so we will put this VL here, okay. So 2 AVL is equal to 2 VL plus VL. Therefore, we will get AVL is equal to 3 by 2 of F VL. Augmented lead is 1/5 time of 1.5 of unipolar lead. That is 3 by 2 of VL. This is the one more beautiful diagram which explains each and everything. This is right arm, left arm, left leg. Right arm is always negative, left leg is always positive, and this is variable. Lead 1 goes from right arm to the left arm, lead 2 goes from right arm to the left leg, lead 3 goes from left arm to the left leg. The one which you are seeing center circle, it is a very one more important thing which explains important concept. You see this one and this one, center circle and this are both are same, okay. Lead 1 goes from right arm to the left arm, therefore it remains 0. Lead 1. Lead 2 goes from right arm to the left leg in this direction. This you can see here. It will become plus 60. And lead 3 goes from left arm to the left leg. It will become plus 120. In the same way, AVR, AVL and AVF. AVR will become plus 210. AVL will become minus 30 or plus 330, and AVF will become plus 90. One more thing you remember, take this graph like this. This is a positive, this is also positive, this is negative, and everything which comes here will be positive, and here on the x-axis everything will comes here will be completely negative. The graph you already know. That is the same thing I want to say. Next, what are chest leads? Chest leads, there are totally 6 chest leads: V1, V2, V3, V4, V5 and V6. How they will be attached on their chest? The chest lead V1 and V2 are attached in the 4th intercostal space. 4th intercostal space along the sternal margin on the right side and on the left side. And the chest lead 4 is attached in the 5th intercostal space in the mid clavicular line. And chest lead 3 V3 is attached between V2 and V4. The chest lead 5 is attached at the anterior axillary line in the 5th intercostal space. And the chest lead V6 is attached at the mid axillary line in the 5th intercostal space. So what? V1 is attached at the V1 and V2 along the sternal margin in the 4th intercostal space. V4 is attached at the mid clavicular line. V3 is attached between V2 and V4. V5 is attached at anterior axillary line. V6 is attached at mid axillary line. Okay. And silica gel is used to attach, and potential is calculated. With and next part we will see how to read a ECG. Okay. Thank you. It become a very lengthy video. Please share in your batch and please support Medico YouTube channel. Bye bye.